All right. So again, welcome everyone. Today we're talking about thriving through perimenopause. So I know perimenopause can feel very, very confusing. I've talked with enough women, including my friends and family members who are like, what the heck is going on in perimenopause? And luckily nowadays there's more conversation around it, I think, than there ever has been, but it still can be so confusing. And so I really wanted to take this time for us to talk about like what actually is perimenopause? What can we do through it? And how can we not only just survive through it, but really feel our best and feel really prepared? I feel like this is such a great opportunity when we're informing ourselves early on. We have an opportunity to feel our best through it rather than just suffering through it and not knowing what solutions we have and then dealing with the consequences later. So really it's an opportunity where we can prepare and sort of know what's coming. It's a little bit of a mixed bag because we can all be different, but we really can know the possibilities that are coming and how to best support our body through it. For those of you who don't know me, I'm Dr. Naylor. I'm a functional medicine doctor, an osteopathic doctor, and I specialize in women's health and fertility. This is my passion to support women through every stage of life. And obviously, I support patients in California virtually. Disclaimer, basically, this is for information purposes only. And even if you're my patient, this is not medical information or a specific medical recommendation. So today we're going to talk about why perimenopause starts earlier than you think, how to recognize the first signs of it, the key hormonal changes that are going on, causing symptoms, and then some things that we can do to best support ourselves through it, how to take control of our hormones and set yourself up for long-term health and vitality. So first, let's start with what is perimenopause. This is arguably maybe like the more boring stuff, but I think this is really critical to fully understanding what is going on in our body. This is the definition, the straw criteria, the stages of reproductive aging workshop. They decided what is perimenopause, and they define it as, well, basically premenopause when you're having, regular normal cycles ranging from 22 to 35 days. Perimenopause is when you start having a change in your cycle length of over 7 days in either direction. Usually it's shorter, but it could be either longer or shorter cycles. And it has to be for at least 2 cycles. And then menopause is when you haven't had a period for 12 months. So this diagnosis is obviously given kind of after the fact. After you haven't been having a period, then you officially get the diagnosis. But obviously there's stuff going on before that. And so it's nice to be prepared before. Um, Now, that's a very broad definition, but this is a little bit more of a fine-tuned way of looking at the stages of transition through perimenopause. Because there really are some very definitive things that happen early on and things that happen later on. So with this definition, we're looking at different stages. -3 is the late reproductive phase where we can still have regular cycles. Maybe they're starting to get a little irregular. We have a normal FSH level, follicle stimulating hormone, or it could start becoming a little irregular, and our ovarian reserve gets lower. So ovarian reserve can be measured by different things. Sometimes it's measured by AMH being low. That's kind of the most common one. And then as we progress into perimenopause, we start having this early menopausal transition, where again, this is where we start hitting that change of at least 7 days of difference in our cycle length, variable FSH levels, and our ovarian reserve is low. That's just a common theme throughout all these stages. Next, we go into the late menopausal transition. This is where cycles become longer. We're not ovulating as regularly, and so we start having a lot longer periods of time without having a period. And like this says, at least 60 days apart from one another. FSH begins to rise at this time, and our ovarian reserve is still low. And then the last stage, the early postmenopausal range or stage, menses have ended. We aren't having periods anymore. FSH is high. Ovarian reserve is very low to undetectable. Again, usually by AMH is really low. So again, these can be, more clear in what we're looking at with our numbers and what we're experiencing to know kind of where we are in perimenopause. It's hard to know. It can be a big transition, a long transition for a lot of women, but at least we can know, oh yeah, you're sort of at the beginning, you're in the middle stages, you're getting towards the end to give us a little bit more, understanding of where we are. A lot of women will be asking me like, okay, when when can I be done with this? If it's bad, they're like, can I please just end my period once and for all? And so again, it can give us a little bit of an idea of where we are with that. So this is a diagram of an ovary to give you a little idea of, again, the premenopausal menstrual cycle. What's normally happening? These are the eggs that are maturing, or I should say follicles that are maturing. They release an egg. And what's really critical about this picture, in my opinion, is that that follicle then turns into this structure called a corpus luteum. And this is where we develop progesterone. The reason I think this is important is because our approach to supporting progesterone, which can be an issue in perimenopause, oftentimes comes from the health of our eggs and our follicles. So it's kind of important to understand that process that's happening, where progesterone is coming from. It's not coming from thin air. To know, also like what symptoms can come up, what we can do about it. Um, you might have seen this before. This is sort of like the textbook way of looking at the normal menstrual cycle. And just again, to kind of touch on what is usually happening before we can talk about what's going wrong, so to speak, or what's changing. These are the hormones that are going on basically from our brain, telling our ovaries what to do. FSH is usually really low. LH spikes just before ovulation and then goes low again. So again, these will start coming up later on in perimenopause. In our ovaries, estradiol has sort of, two little curves here where it's going up before ovulation, it drops down, and then it comes back up again after we ovulate. And progesterone is low until we ovulate again because that corpus luteum, also up here, is producing the progesterone. So we don't have progesterone until we ovulate. Again, this is key because when we're not ovulating, then we don't have any progesterone on board. And so a lot of symptoms can come from that. And this is the uterine lining. So this is what a cycle can look like in perimenopause. This is across 14 different, I'm sorry, 114 different women through their cycle. This first picture is estrogen or estradiol, the primary estrogen, and this one is progesterone. And this is how variable and crazy cycles can be. It can be completely different from one person to the next. So again, a good representation of what could be happening. Um, and this is another picture. So these are basically called loop cycles or luteal out of phase cycles. What can start happening in perimenopause is that we're not having the normal recruitment of eggs where one egg ovulates and then we have, this cascade of hormones that happens and then it goes back down. What can happen is we start having overlapping cycles where basically this is like a recruitment wave of an egg being ovulated. And then suddenly this can happen again because we don't have the typical negative feedback loop that's usually happening. And so we can start having like layered ovulation happening on top of each other. And this is something that can cause a lot higher estrogen levels, which is common in perimenopause. This doesn't happen for everyone, but this can happen, and this can be an explanation again why we're having completely different symptoms than we've ever had, or very different timing outside of our normal cycle. I'll keep an eye on the chat here too. Let me open it up in case you have any questions while we're going. Again, I'll answer a lot of questions at the end. Okay, perfect, Mackenzie. I got your question. Oops, let me go back. Okay. So typical hormone patterns in perimenopause. So this is just it written out, and I'll show you in a second. Basically, like I was mentioning before, ovarian reserve declines. This usually is shown by AMH lowering. This anti-Mullerian hormone. It's basically a hormone that's produced by growing eggs, those growing follicles. And it sort of acts as a barrier. So we're trying to ovulate. It's sort of like a barrier to the next step. So if we have a lot of eggs going, then it keeps them in check. This lowers as we have less eggs that are trying to ovulate, basically. Like I mentioned, FSH increases. And the timing here is they basically look at these as years before your last period. So again, we're really like looking back in time once it's already happened. But again, to give you an idea of when this typically happens, FSH starts to increase, more towards the middle of perimenopause for most women. Usually 3 to 4 years before their last period, we start to have an increase in FSH. LH rises a little bit later, 2 to 3 years before the last period. Estrogens may remain the same or increase initially before they go down. Usually we think about menopause like flatlining, no more hormones, but really they're often going a lot higher before they drop off. And then progesterone slightly declines over the years prior to the last period and is not present if ovulation doesn't occur again. So something that's really common during perimenopause is we're ovulating less and less frequently. And so we're having a lot less progesterone for that reason also. And then even when we are ovulating, then we're typically having less progesterone when we ovulate. So this is sort of a timeline. If you think about like if we were looking at almost like a woman's lifespan of what her hormones are doing, simplified of course, this is premenopause where, we're having these regular cycles each month, and this is what perimenopause can look like. We can have these long periods without cycling at all, without ovulating. We can have a lot higher progesterone, or I'm sorry, estrogens here. Our progesterone can be bottoming out. So chaos basically. Like to describe it as there, hormone chaos before it, flatlines out. Again, this is where FSH goes high, LH is higher than typical, and then the estrogen and progesterone go low. So from there, again, this kind of like, hopefully that isn't too overwhelming, but hopefully gives you some context of, okay, well then what are the symptoms we're expecting to come out of that? Again, not surprisingly, some of the things that go along with those hormone levels. Um, to kind of, again, go back to sort of the timing, about 20% of women at 40 years old are considered perimenopausal in a New Zealand study. So that means that this isn't for everyone, but at age 40, 20% of women are entering perimenopause at least. Again, a lot of these things are before, basically 3 years before the last period. About 70% of cycles are ovulatory, meaning each cycle you are ovulating. 2 years before, it's about 50-50 that each cycle, maybe you're ovulating once, not ovulating the next. And that's where, again, those cycles can become really irregular and more long. And then 1 year before, only 22.8% of cycles are ovulatory, meaning you're ovulating much more infrequently. Here's some of the common symptoms in perimenopause. Some of these are pretty vague and can be attributed to other things also, which can make it confusing. But fatigue, insomnia, and that can be, variable insomnia, irregular cycle length, like we talked about, irregular period consistency, even having lighter periods, heavier periods, more painful periods, um, changes in your mood, more anxiety, which could be all the time, more irritability, worsened PMS, which would typically be just before your period, but can be a lot more heightened than ever before. What are called vasomotor symptoms, which are like the hot flashes, night sweats that we usually think about with menopause. Weight gain is a really common one. And then maybe some of the not as common ones, or at least more confusing ones. We could have tingling in our limbs, hair loss, low libido, or heightened libido temporarily, during it, depending on where you are in perimenopause. Change in vaginal discharge, palpitations, frozen shoulder is really common more towards the end of perimenopause and menopause, and weird smells. So it can feel again, very confusing. A lot of women have this experience of like, my body is not my own anymore. Things just get wacky. Again, a lot of these can go along with the hormones, though. When we understand what our hormones are doing, okay, it makes sense. If you know that estrogen is promoting the growth of our uterine lining, doing things like making our boobs bigger, and that could cause breast tenderness. Then, it can sort of make sense a little bit of the symptoms that may feel crazy and bizarre. And peek at the check. Um, And Mackenzie had asked, could you have changes that are showing up before menstrual changes. Absolutely. And that's very, very common. So again, that's why I like to talk about this, where the definition is one thing, but a woman's experience can be very different. Oftentimes, from what I see, is that we start to have some changes that later on we look back and go, oh yeah, that was perimenopause starting up. And Kelsey has a change in vaginal discharge could be, for one, we could have normal vaginal discharge that is just more. So, more discharge that goes along with estrogen is a really common one because we have more estrogen on board. Toward the end of perimenopause, it could be different though. It could be drier. It can be almost like a different color, which sounds maybe gross, but more like yellowish. Um, and that's more so with less estrogen. And frozen shoulder is bizarre. Again, it's from the low estrogen because we basically have estrogen receptors over our entire body, in our brain, all like in our bones, everywhere. And so a lot of these things can come up in response to especially when we're having low levels of estrogen. So the challenges of diagnosing perimenopause, symptoms can be so variable throughout the cycle. Most women aren't aware of what's happening with ovulation. So they're not expecting to have variable symptoms when they are ovulating, when they're not ovulating. So it can be very confusing. One cycle, they could be like, oh, I have terrible PMS and I feel like a teenager. And the next cycle, they don't ovulate and they feel like a postmenopausal woman and they have, no libido and they're having hot flashes and night sweats and they're like, what the heck is going on with my body? Um, and symptoms can affect each other also. So my example here is hot flashes could worsen your sleep. If you're having worsening sleep, you could be more irritable, feel more depressed. And even that could just be one night that could happen. So it can feel very confusing too to know what's what. Some predisposing factors to be aware of also is that some factors can make us more at risk of having worse symptoms through perimenopause or, worse outcomes. So overall, our hormone levels or hormone sensitivity, each woman is different here. Some of us, tend to have higher or lower levels of different hormones. If we have previous depression, anxiety, insomnia, that of course will then make it, more likely for us to have worsened symptoms in perimenopause. High stress, if we're just always going, if we're always stressed out, that's a really big predisposing factor to have a harder time. And different toxins like phthalate exposure. Phthalates typically goes along with fragrance in products. And this has been shown to increase the risk of poor outcomes in perimenopause, particularly vasomotor symptoms, which again are those hot flashes, night sweats, and cardiovascular disease, which disease risk increases in menopause anyway. So we can have a worse time with that. So tracking cycles, this can be really helpful. Going through perimenopause can also be more confusing, again, because things can be so variable. Some things to note with tracking cycles through perimenopause is that PMS won't occur in an anovulatory cycle. We could still have those types of like irritability and things like that, but it shouldn't be the constellation that looks similar to PMS. And in these situations, bleeding might kind of sneak up on you. This can happen when you're not having PMS also, but if usually you have PMS and all of a sudden you had a cycle where you didn't have PMS and then all of a sudden you started bleeding, most likely that's an anovulatory cycle where you didn't ovulate. And those menopause symptoms, again, the night sweats, hot flashes, those may arrive in low estrogen windows throughout a regular menstrual cycle, particularly, sometimes around ovulation, right before the period or the first few days of the period, or in longer stretches without ovulation. So some of this is somewhat normal anyway, having a little bit of disrupted sleep, a little bit maybe being more prone to feeling hot at night right before your period. Not uncommon because of the drop in hormones. But during perimenopause, when hormones are going a lot higher, dropping more erratically, then we're a lot more prone to having those symptoms from the drop in the hormones, again, throughout the normal cycle or in these longer stretches without ovulation. So this is an example of what a chart can look like with tracking a cycle in a normal cycle. I'm showing this to show you what it can look like to track cycles if you're not familiar. what normally happens is that we're looking, okay, here's our period, we ovulated around here, our temperatures go up, and then it goes down. And this can give us a lot of information about what's going on in our body. For one, the time between ovulation and a period, um, where our temperature is staying nice and high. This can give us insight into what progesterone is doing because progesterone is responsible for that temperature rise. Um, Again, it can give us like just the overall cycle length, gives us a lot of information. So I think this is really helpful, and honestly critical when you're in perimenopause or not. I think it's really helpful for every woman. Um, to understand what's going on. And from my perspective as a doctor, I find this really helpful when my patients are doing this. So I can say, okay, like let's look at your chart, and I can go back with them and say, oh yeah, you didn't ovulate, you did ovulate, and it sort of help explain why symptoms were showing up, why symptoms were different in different place. So it's really helpful. And again, doing something where you're tracking with temperatures, where it's just automated, can be helpful when you're in perimenopause because it can be confusing and it may not make sense at the time when you're going through it, but at least that way you have something to go back to understand a little bit more. To touch on some of the health risks that come up in perimenopause and menopause, it's kind of alluding to these: bone loss, like osteopenia, osteoporosis, cardiovascular disease. This risk increases as FSH increases, so more in the middle to end of perimenopause, and is more involved with the low estrogen. Women with PCOS may not get the same protection from treatment, especially hormone replacement treatment. Kind of threw this in there because I just think it's really interesting that each woman is different. And the biggest takeaway is just, knowing what your body is doing and how to best support your body can be really helpful there. Low thyroid function increases the risk of cardiovascular disease. So if you have like untreated thyroid issues or like low thyroid, be an issue. There can be cognitive changes. Again, those estrogen receptors in our brain, metabolic syndrome, diabetes, insulin resistance, weight gain, elevated blood pressure, elevated triglycerides, as well as things like carpal tunnel, dry eyes, increased kidney disease, or decreased kidney function. So not to share this to make you afraid of all of this, but things to be aware of, and things that should be part of the conversation when you're talking about treatment if you're having bad symptoms. It's not just the symptoms, it's also, these risk factors that are worth talking about with your doctor. So supporting a smooth transition. Again, this is something that we're not going to avoid. We can't not go through perimenopause and menopause, but we can do it in a way that feels better. Again, hopefully we're feeling more empowered and informed, but then also we want to make sure that our body is working at its best to be able to deal with the hormone changes and things, having some resilience. Um, some of the foundations for hormonal wellness are really important to talk about. There are so many different products and things out there that are, marketed in perimenopause to try to relieve some of the symptoms. But honestly, at least 70% of symptoms can be improved or alleviated with the foundational things. So I think they're so critical. And honestly, if you don't have these things down, some of the supplements and things might not even do anything because you're not in a place to be able to benefit from them. But then if you are doing these, then you can, really benefit from some of those other things in addition. So things like nutrition, movement, sleep, stress management and rest, connection, community with other people, joy, awe, and fun, which are usually not talked about, or at least not as frequently with your health, but these are super critical also to just be at your best, to have the most wellness. So a little bit about nutrition, particularly around perimenopause. Um, Again, another thing that's like very common nowadays to hear about protein. It's really important, especially in this phase, to really help stabilize blood sugar, which can have a really big impact on our energy, our mood, our hormone levels, as well as to support our muscles, which are really important for longevity, detoxification, cellular health, really important for, again, keeping those hormones in check. Um, Getting plants in your diet. So, vegetables, fruits, having fiber is really important for detoxification of excess estrogens and digestion, which is also really important with the getting rid of estrogens. Antioxidants to combat oxidative aging, which basically the aging process in our body is just time on this earth of the insults that our cells are having to deal with, basically. And antioxidants can help undo that a bit. I don't like the conversation around aging and like anti-aging. They feel like the wording is not quite right. Really, what we're trying to do is slow down the process of oxidation and really allow our cells to be able to combat the insults that they're getting every day. And color from plants is the number one place to start with that. Hydration, again, really important for detoxification, our digestion, our cellular health. So can't forget to hydrate. And portion awareness. So I added this because, again, weight gain can be really common in perimenopause, can be a really early sign. And naturally, our calorie burning ability basically goes down. Our basal metabolic rate, this is the calories we burn just from living and breathing, decreases with age naturally. And so we want to be aware of, the portions that we're taking in with our diet and really making sure that we're not getting an excess amount of calories from things that we don't need. Um, so yeah, it's not necessarily having to be on a calorie restricted diet. There's a big difference there, but being really aware of portions. Movement in general, again, really important, particularly resistance training is really important in this phase, basically building more muscle than we're losing. Because as we age, even from our 30s beyond, but especially in our 40s, it can be a lot harder to put on muscle, keep muscle on. And this is really important for our metabolic health, for longevity. So making sure we're doing something to build muscle and ideally doing it in a way where we're progressively increasing the weights that we're using. um, Sustainable cardiometabolic training. So basically, this is cardiovascular training, like cardio, but sustainable, meaning that, we're not out there trying to do these, long runs or something that feels really not good on our body, doing something that feels great. So this could be walking, this could be running, it could be really whatever you enjoy, dancing, jumping on a trampoline, whatever you like doing, but again, something that feels really good to your body so that you can do it ongoing. Impact exercise. So this is really especially helpful for bone strength. We want to have some sort of pressure on our skeleton, basically, to give our bones the message to stay stronger. So doing something that's helpful there, nowadays I'm seeing everyone walking around with a weight vest. I just got one too, actually. Things like that, like walking with a weight vest, it makes it harder too on our muscles, but also it's putting a little bit more pressure on our skeleton. Again, jumping, this could be running, something that's getting that impact going. And then non-exercise movement is also really important for our general wellness and metabolic health. We actually burn more calories from just the movement throughout our day than we do with exercise. Meaning, rather than sitting in a chair all day, getting up, moving, walking, doing the dishes, doing laundry, things like that are actually more important with calorie burning than exercise. So being aware of what movement you have. A lot of people like tracking your steps can be a great way to do this to just see, what am I doing throughout the day? How active am I being? And sleep is really, really important here too. So sleep is basically when our body restores itself and when a lot of hormones are secreted. We want to be able to prioritize a certain amount of sleep, 8+ hours, and making sure that we're in bed long enough to get that. So one common misconception that I see is like, oh yeah, I'm getting 8 hours of sleep because that's the amount of time they're in bed. But with, waking up in the middle of the night, laying in bed a little bit, sometimes it's actually a lot less than that. And people don't realize until they start tracking their sleep. So making sure that you're being aware of, okay, I'm in bed for this amount of time, but maybe I was asleep for, less than that. Um, Promoting deep restorative sleep. So doing things to allow our body to get into like the deep sleep that our body really needs to be more restored. Again, unless you're tracking your sleep, you might not know like what kind of deep sleep you're getting, but feeling really restored in the morning can be a great measure of this. Like, are you feeling really rested in the morning? If not, doing things to promote more restorative sleep, like avoiding screens before bed, having a cool, dark bedroom, doing something really relaxing before bed, like good meditation can be awesome before sleep. This can also help with keeping you asleep throughout the night. So it can be really good for managing if you are having nighttime wakings, as well as balancing blood sugar and cortisol throughout the day. So if you are more prone to waking up in the middle of the night, oftentimes it can be related to our blood sugar crashing over the night, through the night, or cortisol spiking, or both. So doing things before bed to sort of stabilize our blood sugar can be helpful, and just stabilizing our blood sugar throughout the day, as well as having some sort of stress management throughout the day to keep our cortisol in check. And sleep hygiene, the little basics can really have a big effect. What I see most commonly is that a lot of little things add up to help. So it's not like, oh, well, I got blackout curtains and it's not working because I still can't sleep. It's like, okay, gotta get the blackout curtains and keep it dark and, have white noise and all of these things to really have them add up. And especially if we're already in a cycle of, our sleep wake cycle is already disrupted, we really needed to do even more to shift it back to a more, normal cycle. And stress management and rest. So the autonomic nervous system is our rest, digest, reproduce versus our fight, flight, freeze system. And oftentimes, so many of us are living in fight or flight like pretty much all the time. So doing whatever we can to shift our nervous system back to the rest, digest, reproduce, really bringing ourself down. I sort of sometimes think about it as like getting to a zero baseline. If stress is, a measure, and say like driving to work, trying to find parking, going to get groceries, thinking about all of our to-do list, we always have some stress going on. Doing something where we're like, okay, I feel zero stress right now, even if it's temporary, doing that can really help balance out our nervous system and help us get back into that parasympathetic system. Cortisol, our primary stress hormone, also our waking hormone, can sabotage our ability to produce hormones. Basically, it can steal from ingredients that would be used to make our sex hormones like estrogen, progesterone. So being mindful about that. Again, it's not like we need cortisol. It's not like we want to like cancel that out because we need it. It's normal, but we really want to make sure that we're not just living on high stress all the time because it really can deplete us. And all perimenopause symptoms can be worsened by stress. Again, like, we can't blame everything on stress, but we can blame almost everything on it. All the symptoms that we've talked about can be worsened by stress. So making sure that this is in check at least as much as possible. It's not meaning that you don't have any stress in your life anymore, because that's probably not realistic at all. But doing what we can to bring our nervous system back down. And there are tools for that when we're really struggling with that, to almost like hijack your nervous system for good, to bring you back into the parasympathetic, support your vagus nerve. Again, connection, joy, awe, these things are also essential to our well-being. So having some awareness around that, like where can I inject some connection with community in my week? Where can I inject some joy, some silliness, some time to just look out at nature and be like, wow, this is incredible. These things are really important to our nervous system, to our well-being. And while we can't necessarily, like, they're almost more obscure to us, we can't really put our finger on exactly what it's doing a lot of good in our body. So an important factor to note also. And then beyond that, just to touch on a few things, I'm not going to go deep into these because, again, I think the foundations are really the most essential things to be aware of at this point. But there are supplements and things that can be helpful in some of these particular areas. In particular, supporting progesterone, making sure you're getting enough B6 can be really important here. Herbs like Vitex, also known as chaste tree berry, can be really helpful here. Helps support progesterone, can sort of balance out estrogen. It also lowers prolactin if that's an issue. So this can be really helpful, especially in early perimenopause. Bioidentical progesterone also, oftentimes I do support my patients with bioidentical progesterone, and it's one of the earlier interventions that we'll do when it comes to hormones, because it tends to be, again, that we're having high erratic estrogens and our progesterone is struggling a little bit. So this can be a great way to start to create some, rhythm, like get back into a rhythm a little bit more, really support those regular cycles, and support the progesterone production if our body's struggling there. And then stabilizing estrogens. So again, our estrogens tend to be higher, more erratic. So doing things to sort of stabilize them a little bit and support detoxification of estrogens can be really helpful. So our body basically gets rid of excess estrogens through our liver and through our digestive system. So supporting our liver and digestion can be really helpful with getting rid of those. So particularly cruciferous vegetables. So it's like broccoli, cauliflower, kale, Brussels sprouts. These have certain compounds in them that help with liver detoxification, especially those estrogens. So that can be great to add into your diet. Fiber in general, getting that roughage from plants can be super helpful with supporting digestion. Again, hydration. And then some of the supplements that can go along with this too. DIM and I3C, these are things that are coming from cruciferous vegetables, basically, but just in a more concentrated form, can be really helpful if we know that someone's really struggling with getting rid of excess estrogens. Calcium D-glucarate is another one that works more on our gut level with getting rid of estrogens. Phytoestrogens can also be really helpful here. So plant estrogens, it sounds counterintuitive, can actually help with balancing out our estrogens. The reason for this is because they're weaker estrogens than our own. And if we eat those, they can sort of take the place of our stronger estrogens and and give our body the signal that things are a little bit more balanced than they might be. So even though people are like, "Oh my gosh, I can't eat soy because that has estrogen in it and that's going to make things so much worse," it actually can make things better. And there are a lot of studies to show that it can help with, the hot flashes, night sweats, things like that. And sometimes these are even supplemented, but even just starting with them in your diet can be great. And there's so much more, again, that can be helpful there, but just to give you sort of a taste of, the starting approach that we would take. And then talk a little bit about testing. I do think that testing is better than guessing, even though testing isn't always going to show us the full picture. Again, our hormones are doing this. If we test our blood level at one time point, we're not seeing the whole picture. So we still want to talk about symptoms, but it still can be helpful to get that snapshot and really see what's going on. Just to kind of give an idea of ways to test hormones. Um, Typically we're looking at blood, most traditionally we're looking at blood levels, but it is again one snapshot that one day. Urine testing can be really helpful, especially looking at metabolites of estrogens. Basically, again, our liver processes estrogens and they turn into this other form of an estrogen. We call it an estrogen metabolite before it's actually pulled out of our body. Some are more problematic than others. So that can be helpful to test and know what our body is doing with those. And then saliva can be really helpful and reliable also, and it's easier than doing a blood test. So if we're needing to test throughout the cycle, that's sometimes a really good option. When to test. Usually we're testing in the morning, and cycle day 3 to 5 is a great time to get a baseline, looking at LH, FSH, estradiol, and some of the other hormones can be great in this time frame to, again, to see a baseline. We're not going to see progesterone at that time though, again, because we don't make progesterone until after ovulation. So this day 21, or basically 7 to 10 days after ovulation, can be really helpful too to look at the peak level of progesterone and estradiol and see what they're looking like in the second half of the cycle too. Just to give an idea of some of the tests that I order, because again, like, we're just talking about the hormones, but in reality, there are so many other things in our body that also affect the symptoms we could be having, our risk factors. So I think it's important still to get a comprehensive look at this or at your body to really know what else could be at play here. And then I wanted to touch on this one test, Dutch test. If you're not familiar with it, basically it's a urine and saliva test that is looking at the sex hormones in the second half of the cycle, as well as cortisol and DHEA, which are our adrenal hormones, our stress hormones. This is a unique test that, I don't always rely on for everyone. We can get a lot of information through blood testing, but this can be really helpful and has this unique factor of looking at the estrogen metabolites that I mentioned. So basically, these are where the estrogens come in. We actually have three estrogens, not just one. And so this is where we see what our estrogen levels look like and what pathway or how much of them are going down each pathway. this pathway is more problematic and can increase our risk of things like breast cancer. So we want to see that that isn't too high. And this other pathway is a little bit more protective, which is great. So we want to see that that is in a good place. And we can get an idea of methylation as well, which is basically how things are activated in our body. So this can be a really helpful test. Again, it also looks at the cortisol patterns because that can have a really big effect on our experience in perimenopause, what our hormones are doing. So it's a really nice way of getting kind of like a buttoned up look at everything. Doesn't tell us everything, but can give us a lot of information as far as, what our hormones are doing if we are entering perimenopause, and how to best support our body through it. And well, if we don't have any other questions, again, thank you all so much for being here. We're going to have the recording available if you want to go back and watch this. We'll make that available to you. We'll send it in an email in the next couple of days at least. And if you have any questions, feel free to reach out. I'm happy to support you. Again, if you're a patient, you can message through our patient portal or email us. If you're not a patient, you can just email us, and I'm happy to help. It's absolutely my pleasure to share this information. Again, I think it's so important for us to be empowered and really understand this process. So it's absolutely my pleasure. All right. Well, everyone have a good night. Hope you all adapt to the time change well over the next week. And yeah, we'll talk to you soon. Good night.